Hello, my name is Joseph Sampson Eterio. I'm a final year student of Public Health Science, Kwara State University. I am privileged to be the group leader for Group 2 of the Fieldwork and Seminar activity of the course for 2 years, like 200 level to the end of the 300 level session. During this period, our fieldwork activities uh, happened in 3 main locations. That's community in Kwara State. First community was Balogun Haladamu community. That's in Ilorin, Kwara State. The second community was in Apeya community. That's in Moro local government of Kwara State. And the third community, that's in Olufadi community. That's in Ilorin, also Kwara State.
Speaking of advocacy, advocacy is the first stage of entering a particular community. In our advocacy phase, we first had advocacy with the community head, the community leaders, and stakeholders in the community. Then after the advocacy, then you have their permission to assess the community. In assessing the community, the first thing we did was community mapping. Community mapping, we identify key units in the community, like the police station, the primary health care center, if they have one, and the schools, whether primary or secondary, if they do have one, and other units, probably association of hunters or farmers, whatsoever it is that is available in the community. During this mapping, we make it known to each of the units, whether school, police station, health center, let them know our plan for the community, and then when we can have an advocacy meeting with the leaders of each of these units. And so that they can all be carried along. So when we need them to participate in anything, in order to foster ownership of the project or intervention in the community. Also, then we move on to the community diagnosis. During community diagnosis, this can be done in several ways. For most of our local communities, we had to tweak some things, like instead of just using questionnaires, we had to add personal interview with some of the community members because of language barriers and all of this. So in the interviews, we record some of the sessions to pick out some of the points that will determine what our health week will be on, and that will determine our intervention for the community and in what way should our coming to the community, what do we need to contribute to the community? Then we identify the major issues in the community, what is spectacular to that particular community, and then we rate them in percentages of what most prevalent issue they do have in the community. And that will inform us on what to do in the community while we are in the community for that particular period of time. Some of these issues might not be addressable during the short period of time we have, so we source for help, probably funding, and then we had a particular means of ensuring that the community partake. That is part of what the advocacy had helped us achieve. So they gain ownership. And in ownership, like I remember in our Balogun community, when we had a head week, the community were the one who actually helped organize arrangements and getting of chairs and tents where people will sit for health checkup and then get to